everyone, welcome to the channel. Thank you so much for tuning in to the Think Nursing channel, where it's all about nursing, travel and lifestyle. Today we're going to talk about some of the common reasons why persons are disliking the host call nurse practitioner job. And the first one is going to be because of the excessive driving. The excessive driving and travel time is something that a lot of persons are not, willing to do. And especially if you're not a lover of driving or, road trip, let's just say that, because by the time you finish driving for 3 hours out of the day, it's more of a road trip. It can be very exhausting. And so one thing I would encourage persons to do is go ahead and cluster your patients, that are in a specific zip code or area, so that way it minimizes your travel time. And that is something that I always do. Regardless of how the office want to go ahead and do their booking, I always rearrange it in my order, so that way I'm not all over the place with seeing these patients. Another thing is because of the unpredictable workload. You have patients who will go ahead and cancel at last minute, or you might have a visit that may need urgent visit. And so sometimes what that does is it disrupts your entire schedule. And so you have to just make sure that you're planning for flexibility when you are working as a nurse practitioner or host call nurse practitioner, and just make sure you're communicating with your office or the person who is doing your schedule of your limitations, so that way they can know that, oh, if I'm going to have you only see 4 persons in the morning, it's only 4 persons, because you want to have that flexibility with your time. Another thing is that, when it comes on to work-life balance, as I say, that is something that I'm struggling with right now. I am struggling with that right now, because after seeing the patients on, in their home, and I drive probably like say 4 or 5 hours out of the day, seeing all of those patients, I have to get home and then finding the time to do the documentation. And that is very, very stressful, because you are like tired, and so you still have to sit down and do all of this documentation, which can be a little bit draining sometimes. But what I would encourage persons to do is go ahead and get some voice to text dictation app or something like that to help you with that. Not feeling safe in some person's home, they're not feeling safe in the neighborhood. And so sometimes what you can do is always have somebody that you have a system in place where you can always have somebody check in with you to make sure whenever you're out and about in those communities, you are doing okay. And another thing is, when it comes on to like the dogs in the house and all that are running around, just go ahead and ask the owners to put them away, so that way you can feel safe in the home. Another thing is that when it comes on to getting your testing done, for the patients, it might be a case where you don't have access to labs, you might not have access to support staff, radiology testing and anything like that, because it is so limited in the host call setting. And so you have to find out that you have to have close relationship with persons in the lab, the pharmacy, all the specialists, so that way you can have that transition of care, or you can have the patient be managed in an appropriate manner, meaning that they're getting their medications on time, they're getting their tests on time, the results are coming back on time. So everything that you need will be resulted, or you will be aware of what's going on for the patient. Another thing is that when it comes on to, a host call nurse practitioner, because you are traveling by yourself and doing all of these visits, a lot of time persons might feel lonely, or they feel as though they're isolated. So one thing I would encourage is to go ahead and join some online NP community group, so that way you can always have persons that you can talk with, and if you have any questions or any concerns, then they will be there to assist you with that. Another thing is the inconsistency with your pay. You can be seeing your patients, and you'll be seeing probably like say 10 patients today, and the next day you'll probably be seeing less than that. So most of the patients that we see are Medicare patients, and a lot of time you might have issues with reimbursement for those patients. And so that is one thing that a lot of persons are not happy about, because there is some inconsistency with the amount of money that they work per week or per day or per month, depending on how you're being paid. So just go ahead and keep a log of all the patients that you've seen, so that way when it is time for reimbursement, there is no issues with the patients that you've seen, in order for you to get your pay. If you're a host call nurse practitioner, what are some of the reasons why you are disliking the profession or the nurse practitioner job if you're doing so right now? I don't know how you're feeling, but if you're feeling that way, go ahead and share it down below, or give me some other reasons why nurse practitioners are feeling the way they are about doing host call services. Until then, I want to say thank you so much for tuning in and making it the Think Nursing channel. But remember to go ahead and subscribe to the channel, like, share, comment, and turn your notification bell on for more content related to nursing, travel and lifestyle. Until then, see you in the next video. Bye.